to the speaker and they will get across to us. Let's go to the next talk. Before we go over to the next talk, I would like to introduce Dr. Borire, Dr. Ni Borire, who is going to be speaking on the impacts of drug abuse on human brain across time. Emphasis on common drugs of abuse. Dr. Ni Borire is an award-winning neurologist, neuroscience researcher, lecturer, author, speaker, and change agent. His research has won many awards, including the prestigious Goldset Young Investigator Award, presented by American Association of Neuromuscular and Electrodiagnostic Medicine. He is the director of Southwest Neurology and a lecturer at the University of New South Wales. He is a change agent with a mission to help people navigate change without losing their purpose, identity, and individuality. He and his wife, Yemin, pastor at RCCG Beautiful Gate, Sydney, in Australia. They are blessed with two wonderful boys. Please, let's welcome Dr. Ni Borire. Thank you for coming. You're welcome, sir.
Thank you so much. Thank you for that introduction. Can you hear me clearly? Am I clear enough? Yes, okay, thank you so much. Yeah, so yeah, I will, thanks again for inviting me. I will be sharing slides because I realize that when I talk about the brain, it's always it's easier to, show pictures because that will sort of put things into context. So I'll be doing that now. Before I start, I want to thank the organizers of this meeting. Thanks for inviting me. I really appreciate that. Thank you, Daddy Astrop, as well, for the honor of, for recommending me for this. Thank you so much. Thank you, Dr. John Adiboye. What a wonderful presentation you've made. I've read a lot about you, and we've chatted a few times on WhatsApp, though we've not met face to face. I remember when I first came to Australia 12 years ago, I was in Perth, and I heard so much about you at the time. And Dr. What's his name now? Francis and Bukola Martins. Yeah, very, very wonderful people. So thanks so much for that wonderful presentation. Such an excellent talk. So I will focus more on the effects of these drugs on the brain, and I'll also put some sort of faith-based ways of dealing with addictions as well on this. Now, interestingly, a few weeks ago in our local church in Sydney here, I actually, on a Sunday service, preached on addiction. And I presented about 48 slides. It was a different Sunday service. So some of the slides will also be shared here. So I really apologize. I will be sharing a few scriptures and talking about a few spiritual ways of dealing with addictions. And I will pivot into that later on. All right, I'll just see if I can share my slides. Okay, sorry, let me just see. Wow. Can you see my slides? Claire? I hope you guys can see it. Let me just see if I can.
Yes, sir.
Okay, all right. So I'll just go ahead now. Just let me know when it's time. I've got so many slides and I can talk. So once it's time, I stop, please. All right. The impact of drugs of addiction on the human brain. Sorry, just give me a second before I start. I'll just bring this into this so I can be sure of what's going on there. Sorry. Just give me a second. I'm so sorry. Alrighty. So let's get this done now. All right, yeah. So I've introduced myself. I'm a neurologist. I'm based in Sydney, and I love my job. All right. For me, neurology is ministry as well. So I take it very seriously. So very simple definition of abuse. I'll just start with abuse. Abuse just means using a drug despite adverse consequences, whereas addiction is much more serious. So drug abuse certainly requires the continuous or recurrent use of drugs to meet whatever needs, despite the fact that there's significant impact on one's ability to carry out their own obligation, or despite the fact that they've been exposed to physically hazardous situations. Um, Addiction, on the other hand, requires more physiological or pathological changes in the human body, and that would indicate some form of tolerance, meaning that there's an increased requirement for more and more of these drugs. So there's an increase in the amount of the drugs consumed, and there's a decrease in the effect of the drug. So when people develop tolerance to drugs, they want more and more of the drugs, and then they may develop characteristic withdrawal symptoms. So when they stop taking the drugs, they start to have symptoms that can be detrimental to their health. And after a while, they will require, more larger amounts of drugs for longer periods of time. And usually, attempts at quitting is often very difficult. So I will go on to talk more about um, illicit drug use. This is um, another sort of term that describes, I hope you guys can see my screen. Can you all see my screen? I just want to be sure. Sorry, I like the feedback. So,
Yes.
okay, yeah, thank you so much. So, illicit drug use can involve illegal drug use, or it can be the misuse or non-prescribed use of prescription drugs, which is becoming a menace. All right, so people can illicitly use drugs when they use illegal drugs, and I will talk about illegal drugs, or they can use legal drugs in wrong ways, or they can use other substances which are not even, which have no therapeutic effect, which are not drugs, like glue. People who sniff glue, for example. So all of these are still sort of illicit use of drugs. Now, before I come um, to this, well, okay, yeah, I'll just talk about legal drugs. We know nicotine and alcohol are not necessarily illegal, so they are readily available. Caffeine is not illegal, and there are a lot of over-the-counter and prescribed drugs that are not necessarily illegal. So consumption of these drugs will not necessarily mean that you're committing a crime. So if you drink alcohol, you smoke cigarettes, drink coffee, or you use prescribed drugs, you're not necessarily breaking the law. But as I've said, you can illicitly use a drug, not even when it is legal. So by taking too much of it, and Dr. Adeboye has really established that the effects of alcohol on the brain and on the human body. Um, I'll give an illustration of a few years ago. While I was doing my PhD, I I was doing some local work as a home general practitioner. So I would basically visit people's homes, and I would, just simple medical issues. So I went to this man's house in the eastern suburbs of Sydney, southeastern suburbs of Sydney, and he was a Presbyterian minister. He had back pain. Looked very reasonable. He was in his mid 50s, and I felt this man, was looked responsible and very, reasonable. So I prescribed him oxycodone, which is endone. I remember, I think it was it 10 milligrams or 5 milligrams? I can't remember. 20 tablets. I made that prescription then, and then later that week, I got a phone call from a detective, and they told me that this man had actually died. He died the following day, the day after I saw him, and they wanted to interview me. Of course, I quickly got the lawyers involved and medical defense, and the whole case took about 1.5 years to resolve. That was the first time I would be involved in a sort of medical legal case. Um, Apparently, my wife and I, that same day when we heard with our practice manager, we started ringing all the pharmacies in Southeastern Sydney to see if he filled my script. It was then I realized that he had about 13 to 16 scripts within a 5 year period. So this man, who was a Presbyterian minister, who looked well, was consuming prescription drugs at an incredible rate. He had a big house. His house was very close to the water, like a beach house, and yet he was hooked on oxycodone. Thankfully, my script was not filled. Of course, the police, they refused to say anything until the whole case was dismissed, and I could breathe. Say, oh yes. And In fact, that was when I learned the power of proper documentation, because I realized that my documentation was not up to scratch that day. I learned that the very hard way. in terms of making documentation with every patient encounter. That's a different topic. But the reason why I'm saying that is that, here is a highly functioning man who really had back pain and then got hooked on prescription drugs. So his addiction to, opioids was not because he was mentally ill. He was a minister in the church, and he had money, he had everything, but he was hooked to opioids through a real medical need. So that is becoming, in fact, opioids, prescribed opioids, now kill more people in the United States than, and even in Australia, than heroin, which used to be the nasty killer. So we've got to really emphasize that this is not just a problem for young people. Older people now are getting hooked to some of these over-the-counter drugs, which is becoming more and more problematic. All right. So we've got illegal drugs, we've got the depressants. I'll just use some very simple terms to just describe this so we don't bug ourselves too much. The depressants are drugs that basically slow down the function of your central nervous system, the CNS. So we've got cannabis, we've got GHB, heroin, opioids. They all depress the central nervous system. That's why, for example, opioids or heroin, if you take too much of those drugs, they can actually suppress your brain function, suppress your ability to reason, and even suppress your breathing pattern. And a lot of people who die, they die from just not being able to breathe, you know, um, because of the depressant, the effect of CNS depression from these drugs. Um, Hallucinogens are basically drugs very similar to what Dr. Dupuy was talking about. They alter our sense of perception. All right. So when you take hallucinogens, you get an altered sense of perception. The way you see things, smell things, feel things change, and some people describe it as a high. Cannabis is one of those hallucinogens. LSD is very nasty drug that can do that. Some of the psychedelics are also well known to do this, including PSP. So these are nasty drugs. Parties, some of them are party drugs that young people take parties where they alter their state. You just want to feel a bit different. So those are hallucinogens. And then we have the stimulants. The stimulants, they speed up the function of the central nervous system. So the amphetamines are stimulants, which some of them are used in a sort of actually in a therapeutic way, but the the real class of drugs of the amphetamines, methamphetamine in particular, is a really nasty drug. So we've got different versions: speed, ice, cocaine as well. And I'll not be talking about all of those because I want to get to the brain as well as ecstasy. So I've just given a brief overview of this. Sorry, let me just go back to this. So this is very hard to sort of really break down, but I thought I'll put it there anyway, just to oppress my audience. So you see all the multiple receptors that all these different um, um, products can activate. They activate all kinds of receptors in the brain, causing different changes in the brain. They open up new circuits, close up some circuits, reinforce some circuits within the brain, and they change the brain. I think that's what's important to understand here. That almost every drug, there's no drug of abuse or drug of addiction that does not alter the brain. They all do. They change the brain. So faces of addiction, I just like this. This was what I used in church just to explain to people in a very, very simplistic way. A lot of people particularly start with experimentation, and I like it. Addiction is like payment on death on a payment plan. You experiment, and then you use socially, and then it becomes a daily preoccupation. Before you know it, you just need to take the drug in order to feel normal. Now, in terms of the stages of addiction, I wouldn't spend too much time here, but I thought I'll just put this up here. A lot of people start with initiation, and then with time they adapt. Some of them may become toxic, but oftentimes, that leads to abuse. And I've talked about abuse. You keep taking something despite the fact that you know it will harm you. All right, but you keep taking it. You just can't stop taking it. It's just like somebody who keeps eating and eating and eating, huge amounts of food despite the fact they know that it will harm them. That's abuse. And then addiction is when you develop tolerance or withdrawal, or when you cannot quit. I'll just move on. So we do know that there are hormonal changes that occur in the brain when people are addicted, or there are hormones that drive addiction. And the main one is actually dopamine, and that's what we'll be looking at today. Dopamine actually, is one of the hormones that is released by the pleasure centers. So dopamine is part of the main driver of the reward system in the brain. All right, dopamine is the main. Now let me explain this to you very clearly for everyone who is listening. There are three main systems in the brain. We've got the um, if you want to start a new behavior, every time you want to start a new behavior or develop a new habit, there are three systems in the brain that are usually activated. You have the focus system or the attention system. That is driven by a hormone called acetylcholine. And what it does is that it directs the attention of your brain to that new habit. So let's say I want to learn how to ride a bike. This is my New Year resolution. Once I make that determination that I want to ride a bike and I generate that thought in my brain, the brain releases a nucleus called the nucleus basalis, releases acetylcholine in the brain, which focuses the attention of my brain to that activity. So certain circuits in my brain, certain networks in my brain are activated for bike riding. Okay. At the same time, the brain also activates the stress system, which is mediated by adrenaline. Adrenaline is actually, the hormone that helps with the fight and flight response, keeps us alert. The reason why the stress system is activated is so that you can be alert. It's for arousal, so that you can be pumped up and ready. You're ready. It's just like when you watch all these athletes who are going for a 100-meter final, Olympics final. If you ask them, they'll say, "Yes, I was shaking, I was ready. My attention." While they're lining up at the start line, they're looking at the finish line. They're focused. If they won't remember anything, they won't even remember the crowd and the adulation of the crowd, the cheering of the crowd, their family screaming, "Go, go, go!" They won't remember that because their brain, the attention system, acetylcholine, is focusing their attention on the race. And then at the same time, they have a lot of adrenaline in them. Some of them will be jittery. Some of them will be shaky. They're pumping up. And that's why you see them warming up on the start line, trying to release the stress because the stress system is activated. But in addition to that, there's also the reward system, which is mediated by dopamine. So when they see the finish line and they can picture themselves getting that, gold medal around their neck, dopamine is released. All right. And that just keeps them going, keeps them going, keeps them going. That's a different talk. That's a different talk. But I just brought that in to let you understand that dopamine mediates pleasure and reward. Every time you achieve a goal, you release dopamine. Every time you achieve a goal, and every time you release dopamine, you reinforce the activity that resulted in the goal. If you eat chicken and you enjoy the chicken, you release dopamine. Dopamine will go back to those networks that were activated in your brain when you ate chicken and reinforce them. So you become a chicken fan. That's how you develop habits that you like. Habits are formed through reward systems, okay, in the brain. So all of those circuits in our brain become reinforced. But if you eat chicken in a particular shop and you develop gastroenteritis, dopamine will be shut down. It will be adrenaline and stress. Anytime you go back past that shop and you remember the chicken, you say, "No, I'm not going to try this chicken." All right. So that's the same way addiction works. When people are exposed to some of these drugs by experimentation, they stimulate dopamine in the brain and they get this high in the brain. And when they do that, the dopamine that is released reinforces that behavior, and then they get hooked. So let me tell you the story. Um, I hope um, I hope everybody's with me. I just hope so. Yeah. Now I had this. This was when I was a registrar, actually, many years ago in Newcastle. I actually did some of my training in Newcastle, and I had this man who was in his 70s, late 60s, early 70s, actually came in with pinpoint pupils in the emergency department. He was found unconscious. So we thought, wow, maybe this man had prescription opioids for knee pain, back pain. Maybe he's taking the incorrect dose. Blah blah blah. So we reversed the opioid toxicity. It became active, came back. And then it was the following day when I was talking to him that I realized that he actually had not taken oxycodone because that was not on his general practitioner's medical summary. Apparently, this man was on heroin. He had been taking heroin. And then the urinary drug screen was positive. So what happened? This was a man, was well-educated man. His son was an addict. And so one day he just walked into his son's bedroom. It's almost, this boy has been an addict in and out of rehab. So he said, "You know what, I'm just going to try." He was bored after retirement in his late 60s, recently retired, nothing to do. So he went into his son's room and he found a shot of heroin and he made it and he shot it. And that's how he got hooked on heroin. His son became his supplier. So we had to restrict the son. And in fact, we knew this because after we reversed him, he went again into whatever. So we don't know what happened. Anytime the son visits him, he will just have a what we call a med call. He will just go, you know. So, people, drug addiction does not respect age. Even the old people can get addicted because they change the brain. So all of these drugs, and these are some of the ones that will focus on cocaine, heroin, cannabis, methamphetamines, all of them impact the brain. Now, this is a PET scan. A PET scan is a type of scan that we use a lot in neurology to look at the functioning or the metabolism of the brain. And this is in a patient who had just had cocaine user who volunteered to be studied. After taking cocaine, within the first 1 or 2 minutes of shooting cocaine intravenously, we're looking at the short-term effects of cocaine on the brain. There was no change in his brain. So for the first 1 or 2 minutes, even though he started to feel out of it, the brain had actually not changed. But within 3 to 4 minutes, the part of the brain called the basal ganglia, don't worry about that, but it's in the deep nucleus of the brain, started to light up. So became metabolically active. So, and this is the part of the brain that is, relies on dopamine. It's the part of the brain when damaged results in Parkinson's disease because people with Parkinson's disease lack dopamine. So for 3 to 4 minutes, within 3 to 4 minutes, that part of the brain lights up. 5 to 6 minutes, it's still hot, and on and on and on until about 9 to 10 minutes. Within 10 to 20 minutes, the effect of cocaine is wearing off. Within half an hour, the effect of cocaine, whether it's $1,000, $10,000, is gone. You're back to where you were. But you see, within this half an hour of injecting cocaine, you flooded your brain because these are the dopaminergic centers. You flooded your brain with so much dopamine. Why cocaine is so addictive, especially crack cocaine, which African Americans, were using compared to the other cocaine that the sort of the white Americans tend to sniff, is so addictive because it goes into the brain of a black man or the typical African American who injects crack, and it stimulates the basal ganglia to produce so much dopamine. They get an intense high that nothing else can give you that amount of dopamine, not your relationship. That's why a drug addict who is on cocaine or heroin will give everything because not their family, not their children, nothing will give them that amount of dopamine in the brain. So you can't match it anymore. And it doesn't matter whether you're educated. It doesn't matter whether you're a doctor. It doesn't matter whether you're a priest. It doesn't matter whether you are a general overseer. If you have that amount of dopamine in your brain, even the Holy Spirit cannot match it. You have to go back to cocaine. You have to go back to cocaine. And the next time you need a little bit more. You need a little bit more. That's why this thing is really, really addictive. So I told my people in church, this is not, listen, if you're an addict, don't just come and say, oh, I give my life to Christ in an altar call and I'm done. You're not done. Your brain has changed. Don't deceive yourself. You're not done. I'm so sorry. I'm also babysitting 2 boys. And I think my second son has gate crashed. What do you want? Oh, so I'm in a meeting. Hey, sorry. Can you give us some time?
Yes.
Go and meet your brother.
Yes.
Okay, thank you. You close the door. Sorry.
Bye.
Thank you.
When is mommy here?
Yes, she'll be back soon. Close it up. Sorry. I apologize. My wife has gone swimming, and so I'm stuck with the boys. Don't have a choice. So let me move on from here before I lose my. Please let me know when I've got like 5 minutes to go. So this is more. So that's I've just used that slide to illustrate the accurate effect of drugs on the brain. So just going back to that slide, just establishing this drug, you can't escape it. And as I've said, when you release that amount of dopamine in your brain, you have to match it all the time. You can get that amount of pleasure, and then nothing else can match it except the drug. So let me move on. What we now note is that after a period of time, that part of the brain becomes dull. And in fact, not just that part of the brain, the cortex becomes dull. I've got a brain model here, I like the brain a lot. I've got a brain here. Okay. So, gosh, I won't have time to talk about this. I'll have to explain all of this to you. But anyway, the cortex, the prefrontal cortex of the brain, which is the part of the brain that helps with your personality, your critical reasoning, your abstract thinking, which is the part of the brain that helps you control your impulses. becomes very inactive after a while. So usually when you get the high comes from below here, the amygdala, which controls your emotions, and then the limbic system and the basal ganglia. Sorry, forget those all those terms. Don't try to remember them. They all release dopamine, okay? And then the part of the brain, what happens over time is that this part of your brain, which controls your behavior, gives you that inhibition, helps you restrain yourself. This is the part of the brain that the Holy Ghost, when you're a Christian, helps you to actually enhance so that you can say no. You know, actually, there's a connection between science and spirituality. We will not talk about that today. But that part of the brain becomes very inactive in cocaine addicts. They cannot restrain themselves. They cannot. So it changes the brain. All right. So I know I've heard people who say, yes, you know, I just go to the man of God, he lays hands on me, and yes, and God can do miracles. I believe in miracles. But not everyone has that universal experience. All right. Not everyone has that universal experience. A lot of people would need a lot of therapy and rehabilitation in order to get better. All right. Now, this is a very interesting experiment. This was an experiment of a previous cocaine addict. So what they did in this situation was to show that cocaine addict a video while the patient was having a PET scan. They showed the cocaine addict a video of nature, mountains and hills and all of those things. Look at what happened in that patient's brain. Nothing extraordinary. But when they showed that cocaine addict drugs, look at that. The brain went boom. The brain, the amygdala, which is this small, tiny little structure somewhere here in the brain, very tiny little structure, controls our emotions and is often activated. It often controls the fight or flight response. So when we see something that really excites us or scares us, the amygdala is activated and you get this stress response. So this patient who's been a cocaine addict has seen drugs in a pictorial form and the brain lights up in response to that. So that tells you that there's memory. You know, the brain, you know, stores the memory of the experience. Our experiences changes our brain. That's what we call neuroplasticity. Neuroplasticity basically means our brain changes based on our experiences. Every time you have a new experience, you change your brain in a way. That's just the reality. Now, from the age of 0 to 25, the brain is constantly changing. After the age of 25, the brain changes, but it takes a bit longer for that to occur. That's why it's difficult after 21 or 25 to learn a new language, to learn a new skill, to play a musical instrument, because you basically have to create those circuits in your brain when you want to form that new habit. All right. But if you have a kid like I have, my kid can understand my own local language and speak very fluently. I speak with an accent, as you probably can hear. But my kids, if you hear them on the phone, they didn't have to learn that. It's just natural for them. That's just neuroplasticity there. All right. So that change occurs with drugs as well. Now, let me move very quickly in the interest of time. Now, this is another very interesting effect of the change in the brain that occurs. This is somebody still in that part of the brain. So methamphetamines and cocaine activate similar areas in the brain to release dopamine. In a healthy person, you see that place is active. In a patient who has had so much exposure to methamphetamines, what happens with meth is that meth and cocaine knocks off these dopaminergic areas after you've been exposed to them for a long time. That's why you need more and more. You need more and more and more because you're needing to push and push and push. Or after abstinence, you see signs of recovery. Same thing here. Look at this. Someone with no drug abuse, no drug use, and then 10 days without cocaine. Look at that. Very inactive brain because of chronic use. The brain becomes dull and dormant. But then about 100 days, you see, not back to normal, but the brain is showing signs of recovery. So the brain is significantly impaired, all right, in different ways. Number one, in the release of dopamine. Number two, in the memory of the drug. So that's why if you are being a drug addict, if you're exposed to the drug, you're going to. That's why avoidance is very important in rehabilitation, drug rehabilitation, because if somebody has been addicted before, if you expose them to the drug, those circuits will be revived and they will fall again to the former addiction. I just put in some of these facts here. I think I'll stop here in the interest of time because I think there are two other speakers, so I will not sort of bore you with this. I think I should stop there. Let me see. I got a message here. All right. Can you still see the slides or you can't? Somebody said they can't see the slides.
No, I can't see the slides, sir.
You can't see the slides? Okay.
No.
Okay. Can others see the slides? Can anyone see the slides? Maybe it's my issue here.
No, no, sir. We can see the slides.
You can't. Oh, okay. So, but you can see me.
Yes.
All right. I didn't know I was not sharing the slides for a while. Okay. But did you see the slides of the brain?
No.
Ah, okay. Let me just show you that. Okay. And I'm not going to go beyond what I've done. Okay. I'll just show you that. I apologize for that. Uh, can you see this now? Can you see this slide?
Yep.
All right, okay. I'm not sure whether you saw this one. This was what I talked about the cocaine experience when someone injects cocaine. Within half an hour, the cocaine is worn off, and you see this area of the brain which releases a lot of dopamine, and that's where the problem is in most patients. And I also talked about this where there's a long-term change after chronic exposure to cocaine. You see, the part of the brain called the frontal lobe becomes really dull and very inactive in a diseased brain. So this patient will have problems with inhibition, stopping their impulsive and critical thinking. And I also talked about the memory and emotional center of the brain called the amygdala. So the amygdala is connected to the hippocampus, which controls memory. So this is a patient with a former cocaine addict who is shown a cocaine video, and quickly that part of the brain lights up, and that just tells us that those circuits in the brain are still there even after stopping, the addiction. If you're exposed again, that person will certainly fall. And I've just shown that the brain changes with drugs and recovery is possible. All right. And that's what I've also explained here. Recovery is possible after drug abuse. Sorry that you didn't see some of the slides, but I think I'll stop there. Thank you so much again for having me.
Thank you very much, Dr. Ni Borire. That was a very wonderful presentation. If you are getting blessed, if you are getting something wonderful, I want you to just wave your hand in the chat button, or you can just indicate, from Zoom that yes, you're not here just for being here sake. Thank you very much, sir. Dr. Borire. That was wonderful. I was part of the Pioneers of Change program that you organized. Um, Free of charge. It was a very, very wonderful experience for me. He's a public speaker, is a change agent. And I just want to ask if you can get a copy of the slides so that people that requested for it, we can give it to them if that's okay.
Yes.
We'll appreciate it. Thank you very much, sir. So we'll get it across to everyone. Thank you very much. I don't know if anybody have any question. Do you want to ask Dr. Ni before we go into the next section? You can drop your question in the chat box. I think there's a question. Yeah, I'm going to read the question out. So there's a question from Smith. He said, I've always been curious to know why, despite all the demerits of abusing drugs, some healthcare professionals still recommend the use of marijuana. The doctors who recommend this stepping out of line. Then the second question is from Bindi, who said, can the brain fully recover? So those are the two questions for Dr. Borire.
Okay, thanks for the question. So for Smith, Tokwe, thanks for that question. Yeah, medical marijuana. I think, to be honest with you, I think that's a settled science now. There's definitely well-established evidence that there are medical benefits of some aspects of marijuana, particularly the CBD aspect of marijuana. Of course, there's another aspect of marijuana called the THC, which is toxic. As a whole, it's a difficult one for ethical reasons as well, because You see, at the moment, the drug we're struggling with the most now are prescribed drugs. The commonest, one of the most common cause of death in the Western world now, prescribed drugs. So the question is that do we need more? Do we need to legalize more illegal drugs? I think that's the ethical question we need to ask. If at the moment a lot of people are dying from legal drugs, why should we legalize marijuana? We know the problem, and Dr. Adigboyi can speak to this. The major problem with marijuana is that marijuana is the entry drug for a lot of all these other drugs. There's no doubt about that. A lot of people who are on cocaine, heroin, ice, meth started with marijuana. Okay. Now, I have prescribed America marijuana. I've prescribed CBD oil in a clinical trial setting for chronic pain and for epilepsy. There's no doubt about that. Some of these kids with really horrible epilepsies who do not respond to conventional medicine respond. And if you had a child with one of these syndromes like Dravet syndrome, where the child would have 50 seizures a day, you would want to try something. All right. So we know that marijuana, for example, is an anti-epileptic. It's one of the recreational drugs that does not predisposed to seizures, unlike cocaine and stimulants, amphetamines, and all that. So what they've tried to do is to extract the CBD oil out of marijuana, purify it, and it's often in an oil-based form. So the ones that, and they're very expensive, about $200, $300 a month. They're oil-based, so you don't sniff them, you don't smoke them. But of course, in America, it's a whole different ballgame where you have marijuana gums, you have, chewing gums, you have all kinds of stuff that, that's completely different. But I have to say that there's some evidence of that some extracts within marijuana is useful. But of course, I still have an ethical dilemma about why we are going to be legalizing. That's completely different now for recreational. I don't believe in that. But if we can get the CBD oil out, which we've done, and treat some of these, conditions, I'm certainly for that. The other question about whether or not the brain can fully recover, we know the brain can recover, but whether it can fully recover after insult is variable. I think it depends on the resilience of the person. Dr. Adigboyi can also speak to that. I'm not sure what you mean by recovery. Recovery can be complete physical recovery without psychological or mental health recovery. And I've got patients, for example, from alcohol-related brain damage. Most patients with alcohol-related brain damage don't fully recover. Whether it's their memory, their intuition or their coordination, and they may be clean and clear, but they lose. But even when you talk about recovery, what about the past events they've lost? So there's always a loss there, but I think from this biological point of view, the brain can improve, the brain's functioning can improve, but people are different. Those that have really severe addictions with severe brain injuries or damage from all of these drugs rarely get back to baseline. They rarely get back to baseline. Oftentimes they have long-standing effects of brain damage. So I'll stop there. I hope Dr. Adigboyi can say something.
Yeah, I think it's good to make a distinction between, this so-called medical marijuana. And we also know that, like you said, the main thing that you want to promote in medical marijuana is the cannabidiol, which is CBD, as opposed to tetrahydrocannabinol, which it's toxic. Now, what happens is this: we need to make a distinction between legalization and medical use. Yes, there are reports of benefit, particularly, particularly relating to pain and anxiety related to physical problems. There are reports of benefit to that. But there's something unique about marijuana and its benefit. Unlike most drugs that we use to treat people, that before they become usable may take 10, 20 years going through processes. Medical marijuana is coming top down rather than bottom up. So there are a lot of political, emotional, and other things that is promoting it. If you look at the American Psychiatric Association and the Australia and New Zealand College of Psychiatrics website and their position papers, the evidences are more tenuous than the level of investment into it for various reasons. Now, when it comes to legalizing marijuana, the state of Colorado did a 5-year study last year because they were the first to legalize marijuana in 2014. So 5 years later, they looked at it. And what they looked at is this, and this is part of what is driving it. The state of Colorado over the 5 years has generated an income of about $1 billion. But then what had happened was that the rate of medical marijuana, of cannabis related accident and emergency presentation had increased about 5-fold, and accident related to it about 2-fold. So there's the issue of revenue generation. And as you know, just like alcohol and the tax benefit and so on, I always tell people, it will not be discouraged until the tax return is less than the cost of treating it, the outcome. So we have to watch the space. Yes, there will be some people who will benefit from particularly predominantly cannabidiol. But if you look at the products that are available now, they have different ratios, okay, ranging from those that have cannabinoids of less than 2%. In Australia, that you can prescribe, okay? Above that, then you have to go through TGA and things like that. But so the products range from, place to place and what have you. Now, in terms of permanent brain change, that is true. So in some instances, in a lot of instances, you can have things get back to normal. But in some other instances, things may never get back to normal. It's easy for you sometimes to spot people that do meth, that use meth. When you speak to them, even if you have never met them before, and they have not used for many years, they have what is called meth mouth because of permanent damage to the basal ganglia. So they keep having abnormal movements that are there. So in a lot of people, that, and like you said, recovery in terms of function, what I call brain reserve. The brain reserve, because of the damage, may become limited. In other words, problem solving down the track and other things, they may never fully attain that again.
Thank you very much, sir. That was wonderful. Thank you, Dr. Nee. Thank you, Dr. John. We appreciate you for your contribution and for showing lights to those questions. So right now we're gonna have 5 minutes break. Let's stretch our leg. If you need to go to the restroom or you want to have a coffee, please quickly do that. In the next 5 minutes, we'll be back and we are having the next two segments, which I believe is going to be wonderful. So please stay tuned. If your friends are supposed to be here are not here, please send the link to them, let them join, and don't let them miss out. Thank you. See you in 5 minutes. Thank you, everyone, for your patience. Thank you for being with us. So, without wasting much time, we'll be going to the next section, um, which is going to be taken by Marvel Adeyemi.